thank you all for being here. You could be anywhere, but you're here for the next hour, if not a little bit more, and it's a safe space. It's going to be a container for us to talk about menopause. It's crazy because 10, 15 years ago, we wouldn't be having these kinds of conversations. We wouldn't be talking about it in this way. We wouldn't even be bringing it up. We probably would get dismissed at the doctor's office like some women still get dismissed these days. So I'm really grateful that you all are here and spending time learning. This is the fourth in our longevity learning series. So we do have 4 more events, and we're pretty much at the halfway point. The next one's on hormone replacement therapy, and this one is more men and women. So it's a conversation about both. I did have a male ask about that specifically. So we're going to just talk about it in general. And then we've got breakthroughs in pain. We're going to talk about melatonin, vitamin D, and sleep. And then the last one's on gut health, metabolism, and the microbiome. As a reminder, remember, this is just for informational purposes only. This is not to be taken as your own personal medical advice. Even at the end, when we do the Q&A, the recordings are off, and we're asking questions for a friend, it is still not medical advice. So we just want to make sure that you are aware of that. And another brief introduction, I'm the lead functional medicine doctor here at Love.Life. I am board certified in family medicine. I'm a breast cancer survivor from my early 30s. And I practice functional and integrative medicine. I specialize in hormones because I think people of all ages need to learn about it, especially women as we go through life. There's so much to learn at all the different phases. And I think that's a very powerful thing to know, is once you get to know your body better. So we are living in a very much unprecedented time where we can approach medicine very differently than the way that our mothers did, the way that our grandparents did. And that is something that we have to acknowledge and celebrate and embrace, that we get to live today during a time when medicine has taken a far different approach than it used to. And what's interesting is Dr. Peter Attia, many of you probably know about Peter Attia, he coined this term in his book Outlive, and he called it Medicine 3.0. And I talk about Medicine 3.0 because it certainly relates to how we talk about menopause these days. And so in the beginning, we thought about emergency medicine and disease treatments, just really focusing on acute care and just getting to the immediate medical needs, very much reactive. And a lot of medicine today can actually still be pretty reactive if you look at it. And then a step further was looking at preventive medicine and risk management. So how could we do screening modalities and imaging and talking to patients about family and personal history? And this is where we've taken another step in the right direction. And then even more so is what you see these days. Many practices are practicing, not many, some practices are practicing Medicine 3.0, which is really more about health optimization. It's about longevity. So we're very much not reactive. We're more preventative. We're more proactive. It's very much personalized. And the ultimate goal is to make sure that we're enhancing lifespan and health span. We're using technology. We're using Eastern medicine. We're using all different types of tools, every single tool that we have in our toolbox to really get us there. And so when you think about what Medicine 3.0 is for some of these practices, you're thinking about prevention instead of sick care, being open and curious to new ideas and modalities, approaching health from a holistic perspective, really stepping out of the bounds of just standard of care medicine. And it's very much collaborative and team-based, where doctors are talking amongst themselves, and also supporting patients in a very different way. I really love the concept of more time in Medicine 3.0 because having a really good relationship with your doctor, no matter how little or how much time you spend, can really go a long way. And then you can see it mentions evidence-informed, where we are combining science with the real-world applications of how people should be treated. And it is more of a personalized medical approach. Now, with Medicine 3.0 comes Menopause 3.0. And Menopause 3.0, I had first heard about it at A4M Longevity Fest. So this is back in December. And when she brought up this subject or this concept of Menopause 3.0, it was how can we as women approach this transition in a different way? And The concept of celebrating that was really important to me for many reasons. And so I'm bringing up the study that she had brought up that talked really about menopause care, about how the biology is universal, we're all experiencing it, but literally every single person has a different type of experience when it comes to menopause. And that's why you see that concept that you'll see flashed a couple times of N=1. How I experience it is not the same as how the next person is going to experience it. We also know that there is lack of funding, lack of research. I think it was something like 2 to 3% of research at NIH is dedicated to the menopause population. That sucks. It's not fair. And so when we think about how much is going into this, obviously, we need more support for women. And then so many of us have had this previous negative experience where you went to see the doctor, you got dismissed, you got discouraged, and then any other time you went to see another doctor, you really felt like that's what was going to happen. That they weren't going to listen to you, you were going to come home, and you were going to wonder, why did I just spend 2 hours waiting for the 15-minute appointment, and I still feel as though I have all of my symptoms. And then the last thing you can see, it mentions primary care lacks information and confidence in prescribing hormone therapy. That is the big topic that we'll be discussing next week, but I am of the opinion that hormones deserve a place in the conversation. And that means for everybody. And a lot of doctors might not include that in their toolbox. And that is also a problem. The last thing that's mentioned in this one is 73 to 75% of women don't get the treatment they need. That means only 25% of the people in this room would be getting the treatment they need. So 3 out of every 4 women in menopause aren't getting the treatment they need. I think practitioners need to hear that again and again and again, because it's a really important statistic. It's so striking that so many women aren't getting the support that they need. Very basics. I think that we all know this, but it never hurts to hear it again, that perimenopause is this transitional period that leads up to menopause when you have absolutely no bleeding or no period or no spotting or no nothing down there for 12 months. And that typically, on average, is occurring around 51. But what we see now is women are actually going through this entire process younger and younger and younger. And that's scary because so many women are also struggling on the opposite end of the spectrum when it comes to fertility and not quite in this arena. So we have to ask ourselves why. The other thing that you can see is menopause. It says hormonal changes stabilize, meaning things start to kind of like get down to a bottom low point. And that usually in some women will stop the symptoms, but there is still some prevention and education that can be had around hormones in general, even beyond that particular point in life. So here's a little squiggle diagram. And I'm not showing you the menstrual cycle diagram because in that one, like many of us probably remember from middle school, it shows you what happens in a 30-day cycle, the rhythmic period where estrogen rises, then you ovulate, and then progesterone rises. What I'm showing here is really more of an x-axis of what happens with women's hormones, sexual hormones over time. And so over here on the left is typically the pre-menopausal patient. And then this diagram here of this wavering of estrogen, this is what's creating a lot of the symptoms, this wavering here of all of that. And you can also see that progesterone is steadily declining. You can see that testosterone is also sloping down and declining because as we age, our body isn't able to make as much of these hormones. Now, that estrogen, I call it no man's land because all hell breaks loose during that time. So for so many of us, this is where all of the symptoms start to happen. And this can happen for women at many different ages. It was really hard to find a group of women photo that I could like put women of all different ages because I think it's also really important for us to acknowledge that people are going through menopause and perimenopause at all different ages. I was very, very young, post-cancer, for somebody who was going through menopause in the early 30s. On the outside, you wouldn't note it. Nobody would notice that. But on the inside, vaginal dryness, hot flashes, mood swing, irritability, the works. And so we have to acknowledge that it doesn't just affect the 50 and up population, that people are going through this at many different ages and stages for lots of different reasons. And remember what I said about symptoms. Each individual unique person can also have different symptoms. This is very much a short list, a very, very short list. Because if we were to write down all the symptoms of perimenopause, this would be like 5 times the list. So we put down a lot of the most common ones that women are experiencing. I think what's tricky here is remember that 75% of women are going to experience something on here. 1 or 2 or 5 or all of the above. And many times they'll go see a doctor and the doctors aren't recognizing that all of these different seemingly unrelated symptoms can also be related to the fact that this person's going through menopause or perimenopause. And so sometimes doctors will just treat one thing. Or maybe they're just going to treat this concentration issue, or they're going to talk specifically about the palpitations. This is why it's so important when you holistically take a step back and you're looking at what women are experiencing, you're actually seeing a different picture about what's going on in their body. Even the timing of when women are experiencing these symptoms, this also gives us information. So some people will roll their eyes when you're asking questions about when did you start your menstrual cycle, were you ever on any sort of hormonal birth control, when was the last time you had a period, have you been paying attention and taking inventory regards to your symptoms and any spotting episodes, are you paying attention? And the timing of when people are experiencing some of these perimenopause symptoms, that's information for your doctor. So that's why it's so important for you to take inventory. I pulled this from last week and I cheated. But I love this because I can't get past it. This is why hormones are so important. And you can see that it hits almost every part of the body and multiple body systems because we know they're all connected to each other. Here we're talking about metabolism and mood and growth and development and your libido and bone density and your immune system and sleep and blood sugar. The list goes on, but this is just a short list to remind yourself of why hormones are important to your body. And remember that when we talk about how we treat hormones, especially at Love.Life, the goal is to look at number 1, listening. Because when women tell you about their experience from seeing that last OBGYN or seeing the last primary care doctor, there is a lot that you can learn from how those experiences were with other doctors, because we literally are taking a step back and looking at their entire history. And then I spend the entire hour just focusing on that particular story. We do different kinds of diagnostics and labs here. We have different types of assessments. We're monitoring symptoms. We're using herbs and nutrients. We are using medications. We talk about different recovery modalities. And if you do want to go on a tour, you're going to see some of those that we use here at Love.Life. And then I love our team of experts. Now, the beauty of having a female-led care team of experts is that we get to sit down in a room every week and talk about our cases, and we are very much collaborative. And that's really hard to find in LA, a collaborative, holistic care team that has board-certified doctors, that has the physical therapist, that has a phlebotomist who's a rock star at drawing blood, a registered dietitian, Chinese medicine doctor, somebody who handles somatic healing, energetic medicine. This is just a short list. I mean, as we continue to grow what we're creating here at Love.Life, this is also going to grow. And so the team of experts that we're going to continue to bring in is something that I can't be more excited about. So why I brought this back up is because I think it's important for us to acknowledge that blood tests and urine tests and saliva tests and at-home, there's lots of tests out there, okay? And not all of it, all at the same time, is helpful. I think that's where you really want to work with a doctor who's going to be collaborative and really focus on just a few things that can be helpful for your unique particular case. And that's what we call precision medicine. That's what we call Medicine 3.0, where it's very much personalized. Informed, empowered, you're aware of your choices. I think that's a huge thing, especially when it comes to the world of hormone replacement, is making sure that you're aware that those choices even exist, especially at times when lots of doctors may have dismissed you. And it's not about hearing, oh, you're just getting older, don't worry about it, because many of us have probably gone to the doctor and heard that one too. Or, yeah, it's nothing, you just need more sleep. Well, if you're having trouble sleeping because you're the one having the hot flashes, then obviously it's an issue. Traditional common health screening tools, and here's what you typically see in the world of women's health and also just preventive. We've got mammograms, we have traditional cancer screenings, thermography and breast ultrasound and breast MRI, very much what we have today, and we're grateful for it because we have access to these kinds of tests. Beyond that, here's more tests that can be helpful. So now you're looking at cell-free DNA and you're looking at new ways to diagnose early stages of cancer. You're looking at fitness assessments like the ones we do at Love.Life. We'll do a musculoskeletal assessment, a longevity screen. We even do VO2 max testing here. We bring in Eastern medicine. We also have tests that look at cellular health and how your body is breaking down the macronutrients and using it from a cellular level. We also do hormone metabolism testing because it's one thing to understand the serum levels of your hormones, but it's another to also understand how your body is metabolizing those hormones. So I think both have value. And then we also have expanded labs. We do recommend that some patients use different types of wearables like CGM. There is testing to look at the entire toxic burden of your body, and even whole body imaging, which you hear a lot about now. Like companies like Prenuva are also offering that. The world of biological age testing, while it's listed there, I still think it's early. But can it be a helpful tool for some people when they're looking at whether or not even their hormone replacement therapy is helping to support decreasing their age, their biological age? And there are a few companies that are offering that. And here's the thing about testing. It's a lot. Not everybody needs to have a test. Sometimes we're thinking about intuition and doing the physical exam and talking to the person and hearing their story. And sometimes that's enough. And we don't have to over-test and over-test. But I bring it up because some people really love data. I love data. But then other people, they really just want to focus on, here's what I'm presenting with, here's how I'm feeling. You've heard what's been going on over the course of multiple decades, and maybe we don't need 5,000 tests. So we have to also respect that too. So let's make sure that we normalize meeting people where they are, that we're listening to you, patients, that we're collaborating. It's not a top-down approach. It's very much us talking together and collaborating on that. And it's always one step at a time. So when I think about what we can do, there's lots that we can do. There are so many things we can do. We can focus on how we eat. We can make sure that we're practicing self-care. We can focus on our blood sugar. We can minimize all of the toxins. 200 or 300 chemicals that so many women are putting on their bodies every day? We can get a checkup. Sometimes people are going to come see me and they say, I haven't seen a doctor in 5 years. I did nothing during pandemic. I didn't do any of my screenings. I didn't get a pap smear, didn't get my breasts checked. Those things are important. And so we have to acknowledge that. We can get testing done. We can support your gut health. We can just take that step to get the blood work drawn. We can make sure that we're focusing on rest and recovery. So I still feel like there's a lot that we get to do. And the way that we do it at Love.Life, like I mentioned earlier, these are all the things that we like to focus on. So the collaborative approach that we've created is one where we're building on community, where people can do on-site diagnostics and lab testing, where they have access to the expert care team, where they can do any of the recovery modalities, where they can send messages directly to their doctor and not have 5 people in the middle just to get a message through. And I love what we're up to because this kind of medicine is very much aligned with Medicine 3.0. I put in hot flashes, and we're going to talk about flashes because 80% of women that are going through menopause are going to experience hot flashes. And a flash, when you've ever had one, you just know it. I think what happened was, I was really young. I was in my early 30s, but when I felt it for the first time, because this is post-breast cancer, double mastectomy, post-chemo and all of that, when I felt it for the first time, you don't know what it is. And then once you start having them more than once, you start to realize that this is what it is. And it's probably one of the more irritating, nuanced, and for some people, it can be really, really debilitating things. So Dr. Jeff Bland, he's commonly known as one of the founding fathers of functional medicine. And we know functional medicine is about root cause and helping people understand why things happen. So from the Personalized Lifestyle Medicine Institute, just recently he did a lecture that was really targeted towards clinicians, but I popped in some important slides because I feel like it's important for everybody to know. And it doesn't just need to be clinicians that get to know about these things. One thing that we know is that we still are researching and trying to understand why women get hot flashes. We just happen to know that as the estrogen levels decline, that there are certain parts of the brain that trigger responses, and one of them happens to be this neuropeptide called neurokinin B, NKB. And one thing that he mentioned in the lecture is he kind of talks through all of the different ways that we are supporting people who are really struggling with these kinds of conditions. And commonly, you'll see that myself and even Dr. Christie, we recommend regularly a lot of these things. And it's not just about supplementation, it's about getting it in through foods, vitamin D from natural light, from getting outside, because too many of us are indoors all the time. Magnesium being such an important one that about 40 to 50% of the population is actually very deficient in. And the list goes on, right? Like that was the first list, and here's the second one. So here you can see curcumin and turmeric's on the list, resveratrol. It talks about different herbs and adaptogens that are also very beneficial for so many people. I also like the rhubarb, that one right there at the very bottom, Siberian rhubarb, also very helpful for a lot of my patients when it comes to mitigating flashes. And the list continues to go on. So here's just a few short examples of some ways that these hot flashes can be mitigated. But I'll tell you that for every woman who's struggling with hot flashes, if they're not sleeping well and they're very stressed and they can't remember the last time they've worked out and they're not sweating and exercising and they're eating all of the ultra-processed inflammatory foods, and we focus just on that, and we check all of those boxes and we help to nurture better self-care and routines, a lot of the flashes go away without adding in a lot of extra stuff. So that's just a little pearl to remind yourself that it's not always about what we can add in, it's about taking inventory about current lifestyle. I brought up EVIA hypnotherapy because there is evidence-based evidence behind this. This is self-hypnosis. It's only 15 minutes a day. They offer a free trial for 5 weeks for this. But this program has multiple studies to back it in terms of something that can help people with hot flashes and relief. Now let's talk about medications and hormones. We're going to go into this big time next week. And I feel like talking less and listening to you all more when it comes to that particular topic because it's a hot one. And it's been for years. It always has. There is this article that is from Avram Blooming, who wrote the book Estrogen Matters. And it's a book all about not vilifying estrogen that is running through our bodies, that is doing so many things at different levels. And the topic of the article is hormone replacement therapy after breast cancer. Is it time? This was probably one of the most important articles that I've ever read on the topic, not only because it affects me as a woman who's been through breast cancer and has gone through a lot of things, but because there are millions of women that are diagnosed with breast cancer every day, and many of them don't know that there are certain treatments that are available to them because doctors might have shut down the conversation and not even talked about it. And so I'm going to be sharing some of this content when we talk about this more next week. When people come to see me at Love.Life and they talk about hormones, they always say, oh, I want to start hormones. I want to get on hormones. But we haven't done all the other things. We haven't focused on sleep and stress, and we're eating poorly, and we're not working out, and there's so many other things. So I never start there. It's certainly part of the conversation and part of the journey and part of the treatments, but it's never the first place that I start. The next thing that I want to mention is that, just like I said, there are lots of things that we continue to focus on that will help support a more easeful, smoother transition for women that are going through menopause. And it's not just about addressing hormones with HRT. We have to acknowledge that. I think too many places that is the only thing that they're discussing with patients, and that's wrong. I think it's important for us to be informed and educated and use it as part of our toolbox, but it's certainly not the only tool. So I'm excited because I get to introduce you to an awesome human being, and I brought Christy for us to do more of a Q&A. Just I want you to get to know her because she's incredible. But we are then going to turn off recording and have the opportunity for you all to just ask and talk about hormone health and menopause. So I'm going to transition to turning this off and taking a little bit of an intermission because they're going to move things around a little bit for about 5 minutes, and then we're going to get into it with Christy. Sound good? Okay. So I first met Christy a few years ago at an almond event, and it was about, 5 of us on that panel, and I knew, like you know how sometimes you just meet certain people and the minute you meet them, you're like, oh no, kindred spirit right away. You just know it. I knew that right away. And then from then, we just stayed in touch. I mean, Christy's kind of like, she's even seen me through so much evolution between like before pregnant to, Jaclyn just about ready to give birth, and she was touring Love.Life. So yeah, thank you. Thank you for being here. And thank you for sharing your time with everybody. And remember that this portion we're going to stay recorded, and then afterwards we're going to turn everything off so that we can just have real talk, okay? So I'm just going to read a little bit about Christy so that you understand a little bit more about her practice and what she's been up to. Dr. Evans, board certified OBGYN. She's a functional women's health practitioner, and she's also certified by the Menopause Society. And she believes it's a privilege to care for women throughout their reproductive journeys. She's also Almond's medical director, and she leads a robust clinical team there that's creating a new model of care that very much empowers women and improves clinical outcomes. It sounds like Medicine 3.0. Dr. Evans is also co-founder of New Dawn Africa, and that supports maternity care and gynecologic surgeries in Kenya, Nairobi, as well as the co-founder of the Village for Mamas, a group that provides grants for postpartum services to new moms in need. She's also done training through the Institute for Functional Medicine, and her goal is to empower her patients to live their healthiest lives through a personalized, holistic approach. And finally, Dr. Christy is a mom to 2 very energetic toddlers. So welcome and thank you for being here.
Thank you so much for having me.
When you heard about Menopause 3.0 at Luminescence, because we ran into each other, tell me from your opinion what really resonated the most with you, like the whole concept.
I think it's the same concept as functional medicine, in general, root cause medicine, where it's not just, to your point, it's not just about getting those hormone replacement therapy on board, which is hard enough as it is, just that by itself.
Yeah.
But it's also all of the other things that are the pillars of health. So it's community, it's sleep, it's your nutrition, it's movement, and it's looking at not only your current health, but also thinking about the future and prevention and wellness and health span. So it's kind of all of that. It's a lot.
It is a lot.
And yeah. I think that's where conventional 2.0 medicine is just not serving us.
Yeah. So when women come to see you at Almond, what's the biggest complaint? Like, do they know that they're even in the arena of perimenopause, or are they getting dismissed by doctors? Like, what are they telling you?
Yeah, I think it's a broad spectrum. I think the great thing is that more women, I think there's more media attention now than ever on perimenopause and menopause. So women are coming in and having done their own research and being able to recognize these are the symptoms that I'm having.
Yeah.
Could it be perimenopause or menopause? And then other women will come in with a whole list of really vague symptoms, and it can be quite a surprise to them that it is actually their hormones that is at the root cause, that it isn't just depression fundamentally, or joint pain, fundamentally, it is at the root cause is a change in fluctuations in your hormones.
Yeah. And do you feel like women are very much open to hormone replacement, or do they not even know about it? Like, what's the level of education around it? Because I find that there's just a lot of misinformation out there.
It sucks. It is all over the place. I think, even through my training, and which is why I had to do the Menopause Society Certified Practitioner courses, because I did not get the education that I needed during residency, even remotely, to have conversations about menopause with my patients. OBGYNs are not trained adequately on menopause. So there is the lack of discussion and nuance and knowledge to in the medical community, oftentimes, to have those conversations with patients. And then there's a fear based on kind of misunderstanding of the data, particularly from the Women's Health Initiative, that has made a lot of people scared, doctors scared and patients scared. Yeah. And then I think that there's a level of just either people aren't talking about enough, and people don't even know that they can really get life-changing help. Yeah, yeah. When I think about what you just said, that is scary to hear that OBGYNs, traditionally aren't getting the training that they need to really serve that population. So that means that we need more practitioners that are open, that are curious, that are taking on additional education beyond that traditional medicine. Otherwise, where are we going to be, right? Like, I think that's why there are practices like Love.Life and like Almond, where practitioners do get that additional training and support, because it's almost like a missing link among 99% of the regular family practice or internal medicine practices or OBGYN practices. And it sucks to even say that there's a lot of lack of knowledge and education and lack of training from the clinician side. And then can you imagine that if that's the clinician side, then how are patients feeling, right? Like, it's that much worse. So when people come to see you at Almond, walk me through a perimenopause patient treatment. Well, before treatment is kind of the full assessment. So we talk a lot about all their symptoms. I go through a really robust history, understanding what their symptoms are, the timeline. We do comprehensive lab work, super important. I want to make it really clear, though, that it's actually, we don't need any lab work to diagnose perimenopause. It's not the lab work that is diagnosing perimenopause, it's the lab work. The lab work is done to understand where your baseline health is, and to rule out other really common reasons why you might also have the symptoms that you're having. So getting data, as much data as we can get, to kind of understand where their current health is, and then understanding what their goals are, their main symptoms, and then addressing those one at a time. We talk a lot about, and again, it just kind of depends on what we focus on first. Oftentimes it's food. I think food first. Sleep is a huge component too. Movement is really, really important, especially in menopause when we're talking about the decrease in muscle mass. Strength training is super, super important, not just for metabolism, not just for body composition, for mood, for balance, and for longevity. We also talk about stress. Oftentimes, perimenopause, is a time when we're caring for young kids, we're maybe caring for our parents, we're at the prime of our careers, there's so much on our plates, and then we also have these health issues. So stress is really, really important. Self-care is really important.
Okay, I don't want to take up too much time in a back and forth, because I think that this is a great opportunity for us to, just talk and ask questions. So we're going to turn the recording off. Thank you, Azusa.